Hello. So in this video I'm going to be walking you through our Mpeke HMI system, and I'll begin from what we are looking at right now, the dashboard, which shows you the analytical details or statistics of what's happening in your hospital facility. For example, to be showing you the total earnings, then break them down into cash earnings or credit earnings, then patient visits at this point, then sales analytics, your inventory to show you what is out of stock, what items are expired, what medical equipments are still in stock, what sundries and then medicines are still present in your hospital, and then also the inpatient statistics of that month, then also the patient statistics, for example, to show you that in your hospital you have this number of female patients and then male patients, and then also break them down by age groups, and then also it will show you the top selling products, and then down here they will show you the time it takes for patients to receive services within a given month. Yeah, and then here we have a patients module. This is in charge of registering patients that visit your hospital, and then after you've registered them, you can go ahead and create visits for them. You can go ahead and admit them, or even just view their biodata. So once a patient has been created a visit for, this is the module that is in charge of handling everything to do with the visits. You can view their previous visits, you can go ahead and then give them triage after they are visited, admit them, register them for a surgery. We have a surgeries module here. Down here we have a surgeries module, so everything to do with surgery in a hospital can be handled by this module. And then also, once a patient has visited the hospital and they want to see a doctor, we have a module to handle everything to do with all the doctor activities. The doctor will take you up, and then once you're taken up, they can do different activities with you. For example, still taking triage, registering you or requesting for other services on your behalf. For example, laboratory services, radiology services. They can do a diagnosis on you. They can still request for a surgery at this point. They can admit you in case they realize that you need admission. They can go ahead and then admit you, and then just maybe refer you or create some kind of notes, clinical notes or referral notes. Yeah, and then we also have a module for emergency, whereby you can record an emergency for patients that come in on emergency. Then we have a pharmacy module to handle all the pharmacy activities within a hospital facility. That is in terms of prescriptions from different doctors. Patients can go to the pharmacy and then they receive prescriptions. And then we also have a laboratory module for if a hospital has carries out lab tests and all activities to do with lab. So the whole process of patients visiting a hospital can be attached to the laboratory process. And then we also have a radiology module, whereby if patients need scan requests or scan services, they can be sent to the radiologist, and then we have a proper way of receiving or addressing those radiology requests. Then you also have a very important module, which is billing. So every service that is offered within a hospital, it will be attached to billing. So before it is received, for example, in outpatients process flow, every service, before it's received, it has to be billed. So we have a cashier billing module where a cashier will receive patients and then we'll break them down into inpatients or outpatients. and then they can pay either cash or take services on credit. For example, for those patients that come in on insurance, they will be well handled by the patients module. And then we also have an accounting. This goes hand in hand with billing. So we have a detailed accounting module that accounts for all the services and then products that are sold within a hospital. Then we also have another module that manages the beds and wards and rooms within a hospital, and then also the process of assigning them to the inpatients. And then down here we have another module called inpatient follow-up. So for those patients that are admitted within a hospital and assigned beds, we have a way of handling them, so a doctor can handle them in a special way. Yeah, for example, they can view their medical history, they can carry out triage on those inpatients, record some notes, request for other services, like what happened for the outpatients, do some diagnosis. And then we also have a module for assigning shifts to the doctors and nurses within the hospital facility. Yes, and then we also have another important module, inventory or stores. This is in charge of handling all medicines and medical equipments and all other inventory that is within the hospital. We have a way, this module will help you distribute it properly and then track whatever you give out to the different departments of the hospital. You can make a requisition, you can go ahead and dispatch inventory to different departments. Then you also have a module for human resource. So before if you have different employees within your hospital facility, you can go ahead and register them here and then assign them roles under the settings module. For example, if you have roles of front desk and then nurse, doctor, so these employees will be assigned the different roles under the settings module and then given accounts to access the system. Then we also have another module that shows you the different reports. For example, the medical reports in terms of laboratory, radiology, Ministry of Health reports, surgery reports, ward reports, death reports, then accounting reports, and then also inventory reports, and then other forms of financial reports. So all these are clearly shown to you, show you the different activities in the different departments of your hospital. Yeah, so basically that's a wrap up of what you should be expecting in our Mpeke HMIS system. It is a full package when it comes to running a hospital facility. Thank you very much.